I am a patient of Dr. Kadry's. I have been for a little over 8 years now, actually. I came to Dr. Kadry after being misdiagnosed from 2 different gynecologists from 2 different facilities. I was in a lot of pain. I had very heavy bleeding. In fact, I had actually hemorrhaged in a very important board meeting where I had to be taken to the hospital. At that point, I really was trying to figure out what was wrong with me. I actually thought I had cancer.
I think generally any person, and I'm talking here about the ladies and women, they don't like to have surgery, which I don't blame them. And if you do it, you have to do absolutely the most minimal invasive surgery.
I had several issues with my gynecological parts for years and years and years, and suffered going through several other doctors that just weren't unable to give me any relief. And I moved to this area and actually got Dr. Kadry's phone number from another lady who comes to see him. Came to see him and was hooked immediately with his professionalism and his attitude and his approach towards women's medicine.
I was really concerned about the effect of the surgery, how it would affect my employment, how it would affect my life, what it would do to my family, and then of course what it would do to me. And it's not a cure to this disease, but certainly it's a way to control it. And I felt very, very comfortable in the capable hands of Dr. Kadry. Many women that you meet in the lobby and all of the testimonials told me that I was in the right place and in the hands of a very capable surgeon. In fact, I doubt that any other surgeon could have even done this surgery. None would have attempted it. 6 years ago, they wouldn't have attempted it, and it hadn't gotten any better in the 6 years that I was waiting to have this surgery.
However, most of the women, when they come to gynecologists, they need surgery for fibroid, for endometriosis, for adhesions, for pelvic pain, for any kind of tumor or bladder suspension or microsurgery or whatsoever. They already, probably most of them, they have seen several physicians, at least in our practice, and they already have decided to do surgery.
Through several small procedures first, we had a laparoscopy to take a look around, take some photos and see exactly what was going on, and then we tried other options. He tried to treat it with the Lupron and things like that, but I had severe endometriosis and my uterus needed to be removed. There was just no way around it. And I was completely for it, being as I'd been suffering for all those years. That was going to be the only way to get it done. And he offered an approach that was unlike any other doctor that had talked to me before, where I didn't have to be completely cut and open. He could do it all intravaginally, and no one else had offered that. No one else could do that for me except him. He had done it to a lot of other patients. I've seen their testimonials in his office, and I thought, what have I got to lose? I'm going to give it a try. And I did it, and it was like night and day. It was a miracle. I immediately woke up right after the surgery and felt so much better. I said to him, "Are you sure you did something?"
We could do almost 99% of the women's surgery without cutting, and which is very my goal for all my entire life to do it, because if my wife or anyone close to my family needs surgery, I don't like them to be cut, and if to do it properly and perfect way in laparoscopic surgery.
The laparoscopic procedure is really, it's relatively painless from a standpoint of being a patient. I know it's hard for the doctor, but you could either have 2 cuts, 2 small cuts. One is for the lighted instrument that goes in where he can see, and the other is an instrument to do whatever lasering or cutting or whatever work he would need to do. In my case, my first laparoscopic surgery was done with only 2 small cuts that healed in a week. No stitches, just little tape marks. Can't even see them. I didn't even know they were there. And that was about 2.5 months ago. This time I required 4 cuts because they had to use different kinds of instruments. They were able to remove all of my organs through the vaginal cavity, which enabled me to have no sutures. They were all internal. And today I got my tape off, and in a week, probably you won't even know that I had surgery. The marks will be gone. So it's relatively painless. I think the worst part is the prep, as with all these surgeries. That was the worst part. And then you have mild gas afterwards, and you're good to go.
Even hysterectomy, they go home next day, and even some of them, they request to go home same day. With very, very minimum pain medicine. Most of them, they go with either Motrin or Darvocet if needed, or even some of them, they don't take any pain medications.
I had heard such horror stories about people having, they couldn't get out of bed, they couldn't move, that they were just sore, that that the cut wouldn't heal, and they would have infections and bladder infections and all these secondary issues. And so I was terrified. I went into the surgery. I was pretty frightened. Didn't know what to expect. I didn't know how I'd feel. And when I woke up, I sort of expected maybe to have some of those feelings, and I had none.
But because of Dr. Kadry experience and understanding of his expertise, I went ahead and had it done, and I am very happy that I had it done. I would recommend it for anybody. He's a great doctor. He's very thorough, very kind, does a great job, and I would recommend it to anybody.
Sounds almost too good to be true.